Question: A 60-year-old woman presents with a sudden-onset severe headache, vomiting, and a decreased level of consciousness. On examination, you note neck stiffness and positive Kernig and Brudzinski signs. A lumbar puncture is performed, revealing an elevated opening pressure and cloudy cerebrospinal fluid, CSF, with an elevated white blood cell count, pleocytosis. Gram stain of the CSF shows gram-negative cocci in pairs. What is the most likely diagnosis? A. Bacterial meningitis. B. Viral encephalitis. C. Subarachnoid hemorrhage. D. Tuberculous meningitis. The most likely diagnosis for this patient is A. Bacterial meningitis. This patient's clinical presentation and cerebrospinal fluid, CSF, findings strongly suggest bacterial meningitis. Here's the rationale for choosing this diagnosis. Sudden-onset severe headache and vomiting. The patient presents with a sudden-onset severe headache, vomiting, and decreased level of consciousness. These are classic symptoms of meningitis, which can be caused by bacterial infections. Neck stiffness and positive Kernig and Brudzinski signs. Neck stiffness and positive Kernig and Brudzinski signs are characteristic physical exam findings in patients with meningitis. These signs are indicative of meningeal irritation. Lumbar puncture findings. Elevated opening pressure. An elevated opening pressure on lumbar puncture suggests increased intracranial pressure, which is often seen in bacterial meningitis. Cloudy CSF. Cloudy CSF indicates the presence of inflammatory cells and possibly bacteria in the cerebrospinal fluid. Elevated white blood cell count, pleocytosis. Pleocytosis refers to an increased white blood cell count in the CSF, which is a hallmark of meningitis. It indicates an inflammatory response in the meninges. Gram-negative cocci in pairs on gram stain. The presence of gram-negative cocci in pairs in the CSF is suggestive of a bacterial etiology. Gram-negative cocci are characteristic of Neisseria meningitidis, a common cause of bacterial meningitis. Now, let's consider the other options. Viral encephalitis, option B. Viral encephalitis can have similar symptoms but is often associated with more profound neurological deficits and altered mental status. The gram-negative cocci in pairs seen on the gram stain are not characteristic of viral infections. Subarachnoid hemorrhage, option C. Subarachnoid hemorrhage can present with a severe headache, vomiting, and decreased consciousness, but it is typically associated with a sudden, thunderclap headache, and imaging studies, e.g., CT scan, often reveal blood in the subarachnoid space. The CSF findings described here are not typical of subarachnoid hemorrhage. Tuberculous meningitis, option D. Tuberculous meningitis can present with symptoms similar to bacterial meningitis but is associated with a more chronic course. The gram stain findings and the rapid onset of symptoms are not consistent with tuberculous meningitis. In summary, based on the clinical presentation, CSF findings, and the presence of gram-negative cocci in pairs on gram stain, the most likely diagnosis is bacterial meningitis, which is a medical emergency requiring immediate treatment with antibiotics to prevent complications and reduce morbidity and mortality.